Hi everyone, I'm met here today with Janine from Blossom Doula Care. For those of you who don't know who I am, I'm Brittany Darling, nutritionist and herbalist, and Janine is a lovely doula with over 20 years experience. I'll let you introduce yourself, Janine.
Thanks. Yeah, so I'm a pregnancy, birth, postpartum doula. I have been a nurse for many years, worked in the area of obstetrics, worked with lots of mums and babies for pretty much the last 30 years in one role or another. And so I connected with Brittany a couple of years, it would be a year ago now. So we've worked together, and I send a lot of clients your way because you're so helpful with babies and colics and reflux and gut and everything, all that area. So yeah, we connect quite a lot, and that's my role. So I work full-time as a doula now.
Great, fantastic. So we're here today because obviously everyone's in isolation, and there are so many mums, whether they're mums to be or mothers who have new babies, or even mums who have older babies or older children that are needing some support in regards to weaning or how to feed their children, or weighing their babies, or having issues with their pregnancy. So basically we've asked our followers, listeners, our people, our WhatsApp group members to send in as many questions that they want for us to answer. So we're going to run through some of those and try and answer as many questions as we can in about 20 minutes.
Perfect.
So, first question, do you have a question that you want to answer first, Janine? I think we should go back to the baby weighing one, because a lot of people can't get into the baby clinics to have their babies weighed, particularly in those first few weeks. It's so important to make sure that they're gaining weight. And gaining weight, that means that they're getting enough milk. So what was your tip that we shared last time?
So one of the tips that I have with my mums who aren't able to get out and weigh their babies is to weigh themselves first, and then put the baby in their arms naked with no wet nappy or no nappy on. And the difference between your own weight and baby's weight is the baby's weight. So you can just sort of see, and because you're using your own scales, your own devices at home to weigh, you can see that the baby's gaining a little bit of weight every week.
So how much weight should they be gaining per day?
So it's around about 150 to 200 grams per week. On average. And obviously, you know, babies lose weight in the first week of can lose up to 10% of their body weight in the first week after birth, and from then they start gaining. But really sort of look at it over a first 2 weeks, 3 weeks period to sort of see that there's an upward trend. And if they're ever concerned, contact obviously a midwife or a lactation consultant, or anybody if they're ever concerned, like, oh, my baby's not gaining enough. Sometimes it's just a lot of reassuring them that they're doing okay, they've got enough milk, baby's settled, feeding, calm, all those things. Then it creates a whole picture. But that's quite a good little tip for weighing your baby.
Yeah, especially when you can't get into the clinics to weigh your baby. Okay, so one of the questions that someone asked was, which probiotics are best when you've taken antibiotics? And I think there's so many variations to this question. I don't have any context behind this question. So I'm going to assume that this person, is either having antibiotics in pregnancy or that they've had it for mastitis or something afterwards. That's how I'm going to tackle this question, because I'm guessing, judging by our audience, that's who it's coming from. So if you've been on a short round of antibiotics, say for mastitis, you don't actually need to take a probiotic. Your gut flora will restore within about 6 weeks, and there's evidence to back that up. If you want to protect or safeguard your microbiome when you are taking antibiotics, there is a strain of yeast called Saccharomyces boulardii, which I kind of tell my clients to take just as almost a preventative. So it prevents antibiotic-associated diarrhea. And so it really helps protect that existing microbiome from any damage caused by antibiotics. All my pregnant and breastfeeding ladies will be on a mother and baby probiotic anyway. So that's going to be sufficient to cover, to rebuild that microbiome. The other thing, so if you are pregnant and breastfeeding and you're not on a pregnancy mother and baby probiotic, I do really recommend that you reach out to me and let's speak about that, because the mother and baby probiotic helps to reduce the incidence of allergies and atopy and things like that, particularly the LGG or the Lactobacillus rhamnosus strain of probiotic. And I do see those mums that do take it, their babies also have less digestive issues and are less unsettled. So I'm getting a little bit sidetracked here. But if you have been taking antibiotics, fermented foods are also really powerful. So things like kimchi or sauerkrauts or even yogurt or milk kefirs and things like that can really help to reestablish the microbiome after antibiotics.
Yeah. Oh, that's really helpful. That's really, because it's so broad. And there are so many things that you can do, but, you know, for mums especially, you know, who may have had mastitis or taking antibiotics for something, you know, the thrush that can ensue after that is sometimes another issue.
Yeah, and I would say the SB or the Saccharomyces boulardii yeast will help to safeguard against the thrush that comes when you take antibiotics. Yeah.
That's fantastic. Thank you. Really helpful.
So some tips for transitioning a 12-month-old to cow's milk. Do you have any tips, Janine?
Oh, look, it's funny, isn't it? Because I was thinking about this earlier. So now there are obviously formulas that transition in. So when you're going from either breast milk or you're transitioning, or baby's been on formula going from one to the other, there are transitional ones now, aren't there? It's sort of like toddler milk, and you know, back in my day it was sort of like one and then you went to the other, which is a big change for a baby or a little one's gut. So yeah, I thought I'm sure you've got some great tips for that.
Yeah, so look, it really is a choice. So there's basically two options. You can go onto a toddler milk, and the benefits of a toddler milk is that it's going to have some of them have the added DHA and also prebiotics, which is going to help with the establishment of that microbiome in the first 2 years of life. And the other benefit of toddler milk is it's actually higher in iron. Cow's milk, on the other hand, is a really poor source of iron. So it doesn't have as much DHA. Well, cow's milk doesn't have much omega-3 fatty acids in it unless it's from a really good high-quality grass-fed cow. So you can transition to normal whole cow's milk, but a lot of toddlers and preschoolers in particular, more so preschoolers, run into an issue with iron deficiency from consuming too much cow's milk, straight cow's milk. So although I love a beautiful organic grass-fed, really good quality cow's milk, if you can get your hands on it, it's great, but really limit the consumption of it. The toddlers really only need 1.5 serves of dairy a day. So when they are 12 months, 1.5 serves of dairy a day. So that's a cup of milk and a slice of cheese. That's not a whole lot of milk. Yeah. So I would just keep an eye on how much they're consuming as well. But in terms of transitioning, if you really want to get them onto a whole cow's milk, if you have access to like a really beautiful, organic, not so processed milk, I would start off by doing 3/4 of their baby formula or breast milk, and then you can add some cow's milk and gradually reduce those ratios. So it's more gradual, and it's allowing their digestive system to adapt to the cow's milk. But you should have really included some cow's milk, not as a drink, but more as in cooking with it or adding it to foods like some yogurt and some pureed fruit, or milk added to make some muffins before the age of 12 months anyway, because we want to introduce those allergenic foods from when you start solids, and then you want to be consistently giving those allergenic foods, including cow's milk, throughout your solid journey and continually, to make sure that they don't become allergic. But I just want to put a caveat in there that if they do have signs of an allergic reaction, you do want to pull back and not keep pushing forward with that allergenic food. So if there is a reaction, obviously you're going to exclude it. But if there's no signs of allergy or intolerance, you're going to continually give it to make sure that they retain their tolerance to that allergenic food.
That's such a good.
I kind of went off on lots of tangents there.
No, that's fantastic, because sometimes I think too, when a little one's had a bottle all the way along and they get to 12 months, you think, well, I do that, if they're used to that and you don't want to stop that straight away, it's really nice to know what to go on to, and knowing as they're getting older, adding more things to their diet and not having them on baby formula right through, because that's true.
And you don't have to do baby formula, toddler milk. And you don't have to do toddler milk, and you don't have to do cow's milk either. If you choose to put your child, say you're a plant-based family, for instance, and you don't want to put them onto cow's milk, you can put them onto something like a fortified soy milk or another fortified plant-based milk. You just want to make sure that fortified plant-based milk has 100 milligrams of calcium per 100 mils to make sure that they're meeting their calcium requirement. But there are so many other foods that are rich in calcium as well. So, there's lots of choices. But after 12 months, you really don't have to give them toddler milk or cow's milk. It's completely up to you, particularly if they're a good eater. If they're a good eater and their solid intake is good, you really don't need to worry about either. But again, like you said, it's a comfort thing. A lot of babies really love that milk. And if you are breastfeeding and you're enjoying breastfeeding beyond 12 months, keep going, breastfeed for as long as you can. The longer, the better. And if you're enjoying it, fantastic.
Yeah. Good tip. Well said. I like that one too.
So do you have a question on your list next?
So how long should a newborn be awake during the day? So this is quite a big question too, although we talk about those wake windows, and when babies are really new, a little up into about 3 months, normally they really only are able to be or want to be awake for 45 minutes to an hour max, from the beginning of the feed right through to when they go back to sleep again. So obviously there's, every baby's different too, but it can accumulate in the fact that they become really overtired by the end of the day. And some babies can look like they're wide awake and they're absolutely fine, because sometimes they can be overtired in doing that. But they're learning a lot and they're doing a lot in that time, and that wake window is really long enough for them. So by the time you've got them up and you've fed them and you've had a little chat with them on the change table and you've changed the nappy and then you perhaps give them a little top up and then I want to go to sleep, normally it's around about an hour.
Mm-hmm.
So, and I find a lot of people come home from hospital not knowing that. Nobody's ever sort of said to them during their hospital stay or whenever how long a little one should be awake for.
So I know I certainly wasn't told that.
No, I know I wasn't either back in the day, a long time ago now, but gosh,
you find out the hard way, because by the end of the day you've got this irate child that you just cannot settle. Like, I remember it used to take me 4 to 5 hours to settle my firstborn when we were going home, because I didn't know that he was overtired, So for how long are they awake? For 45 minutes to an hour? How many weeks until they sort of can go for longer stretches?
Up to about 12 weeks. Like over that time, as they get sort of 3 months and definitely towards 4 months, it extends over another half hour, but you can read them quite well. If you start to recognize their little sleepy cues, whether it's a yawn or they get a bit twitchy or they get a little bit grizzly, and you'll see that if you lie them down for a minute or two for a little play after the nappy change, you think they look fine, and then 2 minutes later they're like they're starting to really get twitchy, that that's time for sleep. So that will lengthen towards 3 months, 4 months, 5 months. That wake window will get longer. But if you really did it for those first few weeks and you start to recognize when they're tired, you'll recognize when it's starting to lengthen a little bit as well.
Yeah. And then during the day, how long do they go down for a nap for?
Well, it's funny because a lot of people think, oh, right, well, that's it, my baby's asleep for 3 hours. And some babies do that, and that's fantastic. But sometimes they can be awake for that hour, they go down, they only sleep for an hour, and then they wake again. And then they go, so they can have varying lengths of sleep during the day. If they can have one, what we call restorative, or calm, peaceful sleep at home in their bed or somewhere quiet in the house or in their bassinet a day, it makes a hugest difference, just so they can just like chill and just rest and have a really good quiet, calm sleep a day during the bed. Then nighttime is a different thing again, but if they can do that during the day, you find a sleeping baby makes a sleeping baby, and they will sleep better the more that they sleep. And it's just keeping them calm. And so it varies, but some do absolutely have that hour awake and they're asleep for 2 hours, and an hour and awake and then they'll have an hour, and an hour awake and then they'll have another 2, because sometimes it's in the pram for a walk, or it's in the front pack while you're going for a walk, or you're doing things. So it doesn't always have to be that they're sleeping in their bassinet, but if they can do that once a day, it's lovely for them.
Yeah, and I guess now, that we're all in isolation, it's kind of the perfect time to be addressing any sleep issues, particularly in older babies, because you're kind of, you're there, committed.
That's it. You're near your bed, so let's be in it. Exactly. Yeah. That's true. And that obviously brings on a whole other set of things too for mums who are feeling like, I'm only at home and this is just overwhelming. So that's why social media and these types of things are so fantastic. And our WhatsApp group, where everybody can chat to each other all day. I've had a Zoom call with all my soul mamas this morning, and so we can still meet once a week. And that's really lovely. You can utilize those as much as you can when you're feeling like you're at home and you're all by yourself. We're all here, so reach out.
Yeah. Okay, so I might jump to nutritional and mental techniques for dealing with morning sickness. So I might tackle this from a nutritional perspective, and then I don't know if you've got any other coping mechanisms that you can add. But so for me, the 2 key things that I think about with morning sickness is vitamin B6 and ginger. So typically in my clients, I will dose them with P5P, which is an active form of vitamin B6. I know there's an Elevate version they do a morning sickness blend, which has ginger and B6, but it's the wrong cheap form B6. So the evidence is now pointing towards that P5P, which is an activated form of vitamin B6, is more effective because it's able to keep consistent blood levels of vitamin B6 throughout the day. So activated B6 or P5P and ginger are my 2 go-to remedies. They're both been tested in pregnant women and are completely safe. Food stuff, I love, and I got this tip from Lily Nichols. She's got a book called Real Food for Pregnancy. She's got a recipe for tart cherry gummies. So basically you get tart cherry juice, set it with gelatin, and then you kind of just suck on those, when you get a bout of morning sickness. Some people also say ice cubes work really well. I used to grate fresh ginger into ice cubes and set them and suck on them as well, which was super helpful. But then the other thing to note is that morning sickness can be, in early pregnancy, it's normal to have a bit of blood sugar irregularity. So women who are so used to, skipping breakfast and having just lunch and dinner might find that they actually need to eat 5 or 6 times a day just in this short period while they're experiencing morning sickness, just to keep their blood sugar level. If you have blood sugar stability, that's really going to help with your morning sickness. So I don't put too much pressure on women to do perfect eating in this stage. Like, hopefully you've done the preconception stuff where your diet's been perfect for, minimum 3 months. So now that you've got morning sickness, hopefully it's only going to last until 12 weeks. That's typically where people see it drop off, the morning sickness. But really having 5 to 6 small meals a day can help. And if you need to have some, Jats crackers or something like that, if that's what is going to satiate that nausea, have those on you and just be snacking constantly. A couple of Jats crackers a day isn't going to kill you, and if it's stopping you from having your head in the toilet, it's definitely a worthwhile trade.
It's a terrible thing, isn't it?
Yeah, and then listening to your body cravings as well. I know Jack and I in our workshop series were talking about it, and my craving was bread. I love the carbs, hot chips, things like that. Yeah, whereas Jack's cravings were dairy, and that's what helped her through.
That's interesting, isn't it? Because listening to your body and listening to what you feel like you need at the time, and little and often, and I suppose when you're tired as well, which those first 12 weeks are you're just exhausted, having something that you can quickly put your hand on, you're like, it's there. You don't want to assemble. I remember that myself. You don't want to assemble anything.
Yeah, you don't want to have to walk into the kitchen, otherwise you're like, oh, no. Can't go through with this. So that's why I say, you know, probably not the best. There's probably better versions, but Jatz crackers, you know.
Oh yeah.
Whatever.
Yeah.
Yeah. I'm just going to close. I'm just going to nip away for a second and close this door because one of my kids has opened it. Now I can hear child noises. So.
Oh, okay. You can't do that. You don't do that.
All right, I'm back. I'm coming.
You're back.
All right. Do you have another question that we can answer, Janine?
I had one of mine for you actually, which was, what is the best multivitamin that you can take for post-baby when you're breastfeeding to stop hair falling out and like all those, you know, when you're feeling like, oh, I know I need something nutritionally.
So two things. You should continue on your prenatal multi when you're breastfeeding. The micronutrient requirements for breastfeeding are actually higher than what they are in general, than what they are in pregnancy. That's particularly the case for things like iodine. So you really need iodine to support your thyroid function, but also as baby's dietary source of iodine. So continuing on that prenatal multi is going to give you 150 micrograms of iodine, which is, definitely going to help with supporting thyroid function, which also helps with hair. So zinc as well, which will be in your prenatal multi, will help with hair growth and also, you know, as a source of nutrition for bub and also wound healing. So if you've had a cesarean, zinc's going to help with wound healing as well. So I would just continue on your prenatal multi. Fish oil is always a good idea. Fish oil is going to help with wound healing. It's also going to, you're going to get a preformed DHA coming through your breast milk. Depending on where you're living, whether you're in Australia or whether you're in the winter season, I would consider vitamin D as well. I always say vitamin D is really important in breastfeeding because it's bubs. Breast milk is actually a really poor source of vitamin D, so you actually really need to quite high dose it when you are breastfeeding. Otherwise, if you are in winter and if you're living not in Australia, the recommendation everywhere except for Australia is to have 400 IU drops given to bub to maintain their levels. It's a little bit different in Australia. In Australia, they say that that's only necessary for darker skinned babies or veiled covered people. But I'm seeing a lot of vitamin D deficiency in my clinic from people that even, you know, going for their early morning walks and things like that. So I am seeing more and more vitamin D deficiency. And now that we're all locked inside, I think we're going to be seeing even more vitamin D deficiency. So I would consider getting your vitamin D levels checked, knowing where they're at. And if bub and yourself aren't going outside much, I would definitely just give bub the baby vitamin D drops. And you can get them from the pharmacy. I'm trying to think of a good brand. There's only a few brands that do them, but the dose is 400 IUs a day. But
is that for immunity as well? Is that
so important for immunity?
Right now, with everything that's going on, I feel like everybody wants to boost their immunity, and that's really good to know. Yeah,
really, really good. So I'll go through baby's immunity stuff in a second as well.
The
other thing that a lot of women find quite helpful when breastfeeding with hair loss and wound healing is marine collagen as well. So you can't take marine collagen when you're pregnant because of the risk of hypersensitivity reaction, but you can take it postpartum. And you just want to make sure that it's a really good source of marine collagen. Obviously, coming from fish, there can be all sorts of potential contaminants. So you want to make sure that you're getting your marine collagen from a really reputable, well-known, sustainably caught source. Yeah.
Well, that's really good to know. Awesome.
Things. But the bare minimum, I would say a prenatal multi is yeah, would be a good place to start. And then if needed, get your iron levels checked as well.
Yeah, that sounds like it. And so you can still, obviously, are you still seeing people right now? Are you?
Yes, I am. And I'm seeing people more. I've opened up my hours more at the moment, just because there is such an increased need. Yeah,
I thought that too. This is perfect timing to be having this chat.
Yes. Yeah. I'm trying to figure out, I had some of my baby immunity notes. Do you want to do, what's another question that we had come through while I try and find my notes?
Came through. I was going to show you actually a really good, just a swaddle that I have that I don't know whether lots of mums know about, but you know, like when you get home from hospital and it's really sometimes like, I can't swaddle my baby. Yeah. These ones here, which actually I ended up buying a heap of them from, can you see that there? I bought some from
like Velcro.
Yeah, so they're actually like a little sleeping bag. And they are so quick and easy, especially in the night time. So they look like a little sleeping bag at the bottom, like this. And then they have these 2 wrap things that go over the top. So you can get them for newborn and for later and for older as well. But they're just a really good little tip. They're just a really helpful. And at the back here you can see.
Oh yeah, they didn't have those when I was.
They didn't have them when I was. No. But I just thought, seeing we're here and I'm showing you things. That's just and at the moment, because they sold out, well, obviously Target and all those places you may not be able to go too soon anyway. But Catch, I bought mine through catch.com.au, and then
amazing, so because swaddling is a real art. I feel like it. I'd swaddle my babies, and then and the arms right. I was like, oh my god, are you kidding?
That is so true. That's why I thought I'd bring that in, because it's really helpful. Yeah. All those little Houdinis that get out there and they love a swaddle. That's a really, if they're overtired and they're really cranky, your 5 o'clock time we were talking about before, it can really help to have a really good swaddle.
And how long can you swaddle a baby for? Is it until they're rolling? Is that?
Yeah. So 4 months, and then as transitioning, you have one arm out, and then you get them used to sleeping with one arm out, and then 2. Once they can roll, it's not safe to be able to have them tight when they can roll. So it's around about 4 months but that varies too with the age of the baby, sort of 4 or 5 months.
Okay.
As soon as they can roll, you don't want to be swaddling them.
Great. Okay, so I'm going to jump into immune boosting supplements suitable during breastfeeding. So what I've been recommending to a lot of my ladies is Forced Pregnancy, but that's now sold out. So
no,
completely sold out. I can't even get it. It's like sold out until months away, I think. So that was a combination of echinacea. So echinacea is both safe in pregnancy and also breastfeeding, but you just want to make sure that you get the right form and the right dose. So the form that you want is Echinacea purpurea. Sorry, the species that you want is Echinacea purpurea. And the dose, off the top of my head, I can't remember, but I think it's something like, I think per tablet of Forced Pregnancy was 750 milligrams. So, and you could take 2 a day. So it's about 1.5 grams of Echinacea purpurea a day. But there's so many other things that you can think about in terms of immunity and breastfeeding. And we started to touch on vitamin D. Vitamin D is probably the key regulator when it comes to immunity. It decreases all the inflammatory cytokines. So things like tumor necrosis factor alpha, interleukin 1, I'm reading off my notes, which I took earlier, interleukin 6, which are seen to be a worsening sort of mechanism in this coronavirus, this current novel coronavirus. They're talking a lot about the cytokine storm and how that's what's making people progress into a more severe cases of this coronavirus. So vitamin D as an immune regulator. It's not immunostimulatory, it's not immunosuppressive, although at too high doses it can be immunosuppressive. So I'm not a fan of the vitamin D injection, which is 200,000 IUs. I'm not a fan of using that, but making sure you're getting your daily requirements. So something like 1,000 IUs a day, which is basically one of the osteal and vitamin D tablets. But if you're deficient, I would dose you much higher. So it's about getting the bloods and knowing where you're at. But if you're not sure where you're at, just take 1,000 IUs a day. That's really safe in breastfeeding. The upper tolerable intake for breastfeeding women is 6,000 IUs. So if you were deficient, we would be aiming for around 6,000 IUs. And same goes for pregnancy, actually. You'd be aiming for about 1,000 IUs a day. Other things that you could take while breastfeeding. Food is medicine. I love a bit of food as medicine. I would be getting into all your Asian variety mushrooms. So the shiitakes, the oyster mushrooms, all of those kinds of things are really beneficial, as well as making sure that you're getting enough vitamin C rich foods. So just simple things like berries, you know. But if you go to the grocery store, buy yourself, 3 bags of frozen berries. Actually, I think you're only allowed to get 2 now. Buy yourself 2 bags of frozen berries to make sure you're getting your vitamin C. The other important one is zinc, but I wouldn't be high dosing zinc. I would just be having a normal dose. I wouldn't be doing any more than around 25 to 50 milligrams, depending on what your levels are. And, this is when it comes back to individualization. But zinc's super important for immunity as well. But it's just getting that dose right and figuring out what things are going to be best for you, because what works for one person may not be the best remedy for another person. And I start having that good gut health, and so the nutrients can pass backwards and forwards through your gut is really important too. And there's actually been lots of stuff coming out on gut and this novel coronavirus as well. So a lot of people are presenting with GI symptoms, and I read something today. No, actually I was on a call this morning, and one of the doctors was talking about people who had GI symptoms seem to progress to more severe a severe stage of respiratory distress, which was interesting. So I think that comes back to leaky gut. So probiotics are amazing. So if you've got your mother and baby probiotic, which should have Lactobacillus rhamnosus, which is supportive of the immune system, but also Bifidobacterium species have been shown to be supportive of the immune system as well. So probiotics or fermented foods. Again, your kefirs, your yogurts, things like that. It's at this stage, I feel like it's whatever you can get your hands on. If you've got a probiotic that you're currently taking, keep taking it. If you can't get your hands on it, do fermented foods. You can make your own yogurts at home. If you've got a bit of yogurt left in the tub, you can just add some milk and leave it at room temperature for a few hours in a bit of warm water, and that's going to make your own yogurt at home.
No, really?
Yeah,
that's cool.
Just give it a little bit of a shake so the cultures kind of mix, and then sit it in like a little bath of warm water for a few hours, and it cultures.
That's fantastic. And kombucha, I think, is that the drink? That's good too, isn't it?
Yeah, it definitely has bacteria and cultures. There aren't as many human studies done on kombucha as what there are on things like milk kefir. Kombucha can be corrosive to the teeth. So if you're having a lot of kombucha, I would just make sure you rinse your mouth out afterwards and drink it through a straw as well. Just be aware that it is acidic, so it will potentially cause dental cavities.
There you go. God, that's awesome tips. Thank you. Fantastic.
I think I got a bit sidetracked there again.
No, it's really important. It's great, especially at the moment. People are wanting and zinc-rich foods. What are your favourite zinc?
Oysters are my favourite. But everyone's like, oysters. Kangaroo meat, another. Is actually really high in zinc and iron. So if maybe there's lots of kangaroo meat left at Woolies because no one likes it. If you make it into a bolognese, you're probably not even going to know the difference.
Please don't ask.
It's a little gamey, but it's not too bad. Other zinc-rich foods, things like nuts and seeds, are going to be fantastic. Zinc. Sardines, and another one that people go, yuck. But sardines are also high in iron, omega-3 fatty acids. They're a total superfood. and they're tinned, so you can, you know,
they're probably readily available right now too. That's probably the one thing left.
Yeah, exactly.
Oh, fantastic.
All right, so immune boosting for babies, I guess while we're on the topic, again, I would discuss with your healthcare provider about vitamin D drops for baby, particularly if you're not going outside. I would also consider probiotic supplements, but baby infant specific probiotic supplements. So there's ones called like Baby Biotic, which are going to be good, that you can just either add to their formula bottle, or if you're breastfeeding, you can just make it into a paste with a bit of breast milk and then scoop it into their mouth. But in general, this virus isn't really affecting babies for a few reasons. Melatonin's been one mechanism that they're saying that it's not affecting babies. So melatonin itself, which is the hormone that's made or secreted by the pineal gland, which it gets secreted in darkness when we need to go to sleep. Melatonin is our sleep hormone. So it is highly anti-inflammatory. So they're saying that this is one of the potential mechanisms to why pregnant women in their third trimester aren't getting, even though they get the virus, they aren't getting the severe illness that progresses with it. So because in the third trimester of pregnancy, you have really high melatonin levels. Same goes for children and babies. Yeah. So that's one of the possible mechanisms. And also babies are protected, particularly if they're breastfeeding. So if you're breastfeeding, you're giving your baby all the beautiful immune supportive molecules like immunoglobulins and colostrum early on, and vitamin A, and hopefully everything they need. So the best thing you can do for your baby is breastfeed. If you're not breastfeeding, I would, if you're doing formula, I would definitely give the baby probiotics as a adjunct to help support their immune system and also their gut health. So your gut is going to be your first line of defense, and your both innate and adaptive immune responses both stem from the gut. So that's really important to focus on gut health. And the other interesting thing about babies is they actually produce quite a lot of nitric oxide in their nasal cavity, which has been shown to be protective against viral illnesses as well. Wow. Yeah, so babies don't seem to be as high risk as everyone else.
Yeah. I suppose for those mums who are bottle feeding, giving them probiotics, lots of skin to skin with baby as well.
Yes.
They're getting microbiome and all of that, and they're just having that beautiful skin to skin time too.
Yeah.
Really important.
Absolutely. Yeah.
Yeah.
All right. Awesome. Next question. Do we have another one?
Pick one on your list.
Oh, pick one on my list. I think we have time for one more.
Let's do that. I love that.
Heartburn, tips for heartburn.
Yeah, that was another one that was on my list for you.
Yes. So I'm assuming in pregnancy, which is completely normal and very annoying at the same time. My usual go-to remedies are a lot of them are contraindicated in pregnancy. So I would be doing something like slippery elm bark, which you can get from the supermarket in the health food aisle. It's this disgusting kind of beigey brown powder, and you can just mix it with some water, and that really helps to soothe the digestive tract. But other sort of lifestyle tips, be conscious of what foods are triggering your heartburn. Make sure that you're not eating too quickly. You're not kind of, take your time, chew your food, all of that kind of stuff. But it is a normal occurrence, a fairly common occurrence in pregnancy to experience heartburn. Don't lay down too soon after eating, all that kind of stuff.
Really a bit elevated. That's the one thing, when babies that have engaged and heading down a little bit further towards the end, you end up with a little more space. Number one, to breathe, and number two, to have a bigger meal or not have that heartburn at the end. It's quite nice.
Yeah.
A reprieve for some of the people at the very end.
Yeah. Do you have any heartburn tips?
Not so much as all of those, just not eating too late at night, and what you're eating, and you're not able to have a big meal when you're very pregnant anyway. But
yeah,
the slippery elm's a great tip. That's awesome, because I think a lot of people, are given the Gaviscons and the Mylantas and the Nexium and all those sorts of things, which are great, and they work really well. And even in labour, people are given Mylanta during labour because sometimes it can feel really regurgitating.
Yeah.
But that slippery elm's a good tip.
Yeah. Yeah. Iberogast, potentially. I haven't given it to a pregnant lady for a long time. I'm just trying to think whether it would be contraindicated, but that's, I often give it to babies as well that are quite colicky or refluxy. It can be quite soothing. That's a Flawless product.
Yeah, and that was the other thing we were chatting about during the week with colic and reflux and those sorts of things, that I knew that you had lots of things that you recommend, that you work with babies with an irritated gut or really upset.
So probiotics, is one of my go-tos, and it typically isn't the normal baby probiotics. It's one really specific strain that's indicated for colic, and that's the Lactobacillus reuteri, and you've got to make sure you get the dose right and all of that kind of stuff. But it is super effective for colicky.
Sorry,
is that your dog? Yeah. How big is your dog? It sounds like it's a wolf.
It's a big wolf.
It's a little one.
He sees me sitting here and he's like, actually, could you take me to the park now, please? That's really what that park is.
Well, we might leave it there because I think we've been going for quite a long time. We're going to upload this video to Instagram somehow. We're going to figure out how. But thank you to everyone who joined us and sat through our chat. We hope you found it really helpful, and we will do it again soon. So if you want to add some questions into the comments of this video, we will loop back at some point and do this again.
That would be fantastic. Well, thank you so much, Brittany. That was really awesome. I really enjoyed that.
Yeah, thanks, Janine.
Looking forward to doing it again soon.
Yes, and good to see you again.
Lovely to see you too. Yes, thank you so much. Lovely to see you. Okay.
Bye.
Bye.